Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. I'm very pleased to see you all. Let me introduce myself. My name is Mas Ardea Pramisiragita, and I'm from Group H, and I will be the moderator today. And
my name is Latifah. You can call me Latifah. Thank you.
Hi guys, my name is Risma Yanti. You can call me Risma. Thank you.
Hi, my name is Najih Utami Wildan. You can call me Najeh.
Hello, I'm Nola Rosita. You can call me Nola. Thank you.
Hello, my name is Susanti. You can call me Santi.
Hi, my name is Zahtan Nabi Rabdi Hamka. You can call me Abi.
Hello, my name is Hams Kaputri. You can just call me Cahya.
okay, thank you. So today we would like to presentation about treatment and prevention of HIV and AIDS. Before we start, I have a few notes. In this presentation, presenter we have a total of 10 minutes for presentation. And we will open the question session after the presentation ends. Now, let's welcome our first presenter for the first session, which will be explained by Latifah.
Okay, thank you, MC. I will discuss about HIV or AIDS. Okay, next, PPT. Okay, about introduction. What is the human immunodeficiency virus? Okay, human immunodeficiency virus continues to be a major threat to human health globally. Approximately 37.9 million people were estimated to be living with HIV in 2018. AIDS stands for acquired immune deficiency syndrome, is a collection of symptoms. An infection or usual is called a syndrome caused by damage to the human immune system because the HIV virus, while HIV stands for human immunodeficiency virus, is a virus that can weaken immunity in human. In case HIV or AIDS is case that is very fatal in it's very fatal about society where every sufferer will end in death. Okay. In terms of treatment, advancement of antiretroviral therapy or ERT has helped maintain health for those who have access to medicine and prolong life and maintain their life. Critical awareness would create a movement that is based on a complete understanding so that intervention program would have high sustainability. Critical awareness is the basis to build collective awareness into group mobilization. People need to understand that they are responsible for their future and they can learn to take control of its direction. Okay, next will be explained with my friends Rismayanti. You can continue.
Okay, thank you, Latifah. I will. Okay, guys. In this presentation, we will discuss about how to prevent and treat HIV/AIDS in order to minimize the transmission of HIV infection. With the hope that one day we will truly be free from HIV/AIDS. A good understanding of how to prevent HIV/AIDS can increase awareness and vigilance in maintaining a healthy lifestyle to avoid HIV/AIDS infection. It must be remembered that there is no vaccine to prevent HIV/AIDS, and there is no treatment yet. Prevention heavily depends on public awareness campaigns and changes in individual behavior in an environment that supports, which takes time and patience. And the next presenter is Nola.
Okay, thank you, Risma. So, and it is necessary to prevent losses in the most able-bodied part of the population by introducing more effective programs for the prevention and treatment of HIV AIDS, since 2% of people aged 35 to 39 years and 1% of people aged 40 to 44 are infected with the virus. And, in spite of the presence of a significant number of antiretroviral drugs, the development of new therapeutic and prophylactic agents to control this infection remains an extremely urgent problem due to HIV variability, the lack of an animal model or escape monkey, and the natural immunity to the virus and toxicity of therapeutic agents and their high exposure. In this regard, the need for new therapeutic approaches and broad-spectrum drugs, biological active substance from algae, polysaccharides, lectins, fluorotinis, or Swedish requirements. The result of the experimental report and clinical studies conducted in vitro and in vivo by worldwide scientists prove the high efficacy of these compounds and justify the need to use them as a potential basis for the creation of new broad-spectrum drugs. Women are women are significantly more likely to have HIV than men. This is because the infection spreads through vaginal intercourse. Because of this, it is extremely difficult for men to acquire HIV from women. For women, however, it can be spared, but through vaginal intercourse and through breast milk. Due to advance in technology over the past few decades, there are multiple methods for HIV prevention available today. The first method is used by all HIV negative people worldwide today. Abstinence from sexual activity or other forms of injection drug use. Okay, next presentation will be continued by Nadia.
Okay, thank you, Noah. I will continue the presentation. In carrying out effort to prevent and control HIV or AIDS, health education about HIV or AIDS can be carried out, such as regarding the meaning of HIV or AIDS, sign and symptom, modes of transmission and methods of prevention. Then counseling is carried out. Then there is the need for informed consent to be screened for HIV or AIDS by taking blood. Next. HIV and similar viruses are generally transmitted by contact directly between the deep layers of the skin or mucous membrane or bloodstream. Fluids that contain HIV, such as blood, semen, vaginal discharge, seminal, and breast milk. Contagion can occur through sexual intercourse, vaginal, anal, or oral. Blood transfusion, needle contaminated string. Connection sexuality is a factor that causes transmission, highest HIV or AIDS. Next. The United Nations Program on HIV or AIDS or UNAIDS is an organization under the auspice of the United Nations that focuses on the problem of handling HIV or AIDS in all countries in the world. This is due to an increase in the number of people living with HIV or AIDS who are significant to the world population. In dealing with HIV or AIDS, UNAIDS has several definite programs for the government of a country that is experiencing an HIV or AIDS epidemic. ART is a treatment mechanism for people living with HIV or AIDS, either through medication or therapy. The next presenter is Susanti.
Okay, I will continue the presentation from Naja. HIV treatment involves giving medication that decrease the program of the virus in the body. HIV is the kind of virus called the retrovirus, and that drugs used to give either a called antiretrovirals or ARV. These drugs are usually made in combination with different ARVs. The unit therapy is called antiretroviral or ART. Some ART drugs have been applied since the mid 1990s and are the reason why the yearly amount of deaths associated with AIDS has fallen over the last 2 decades. Okay, next slide. This drug is used to reduce the change of viruses developing resistance, or has potential to reduce mortality and morbidity among people infected with HIV and to improve the quality of people living with AIDS or PLWHA life. It is also used in standard HIV treatment. HIV disease can be managed by treatment regimen composed of a combination of 3 or more antiretroviral ARV drugs. Current antiretroviral therapy or does not cure HIV infection, but highly suppresses viral replication within a person's body and allow an individual's immune system recover to strengthen and regain the capacity to fight off opportunistic infection and some cancer. Okay, that's for me. I'll leave to the next presentation to Abi.
Okay, thank you. I will continue the presentation. Next slide. Okay, HIV prevention programs building individual skill needed to use prevention community properly and run preventive and medical service in parallel. Programs to prevent HIV transmission often compete with programs to treat people suffering from AIDS for limits research with numerous challenges such as management issue and deep-rooted cultural constraints. Okay, the material is finished. Chaya, maybe can convey the conclusion.
Okay, we have heard the entire presentation of the material from our great presenter, and now allow me to conclude from what has been conveyed. So we know that approximately 37.9 million people are currently living with HIV/AIDS. So that's why it's necessary to prevent the loss of the healthiest part of the population by introducing more effective HIV/AIDS prevention and treatment programs. Due to technological advance in the past few decades, there are multiple methods for HIV prevention nowadays. Some of these are avoiding the use of drug injection and abstinence from sexual intercourse. Unsafe sex can lead us acute STIs, which can cause infertility and severe illness. Several STIs, particularly those involving genital or perianal intercourse, might facilitate the sexual and transmission of HIV infection. In order to prevent prevalence of HIV/AIDS, there is a need for HIV/AIDS related health education. Effective communication for health targeted people who use stimulant drugs require addressing the challenge. They are crafty messages that can overcome long-standing distrust, fear, and finding effective means of reaching people who use stimulant drug with life-saving message and material. Okay, maybe they just from me. Now I return to the moderator.
Okay, thank you so much for the presenters for making such a great presentation. If you have question for the presenter, you can leave it in the comment column below. And thank you so much for watching and following our presentation. See you on the next presentation. Thank you. Bye.